Voices started researching the non-emergency medical transportation privatization failure in Wisconsin last spring. The Tuesday before Thanksgiving, we got a phone call from a transportation provider in Milwaukee. A company owed $10,000 by LogistiCare. This person was happy and grateful that the Department of Health and Human Services had just announced that LogistiCare was leaving the state. This was the first that Voices heard of this. We also took this as good news. But it now appears that any proclamations about LogistiCare's demise in Wisconsin are greatly exaggerated. Voices has confirmed through some highly qualified sources, whose identity we protect, that despite what Governor Walker's Department of Health and Human Services has announced and what the media has reported, LogistiCare has no plans on leaving Wisconsin. They're manipulating their service failure to reopen a lucrative contract, going back to a bid system that many believe was gamed in the first place to demand even more money from the state of Wisconsin. Currently, LogistiCare claims their exclusive contract to broker non-emergency medical transportation in Wisconsin does not pay them enough to provide the services they've contracted to provide. Curiously, the contract was initially reported last year as being worth about $33 million. This year it is being reported as being worth about $38 million. Lonnie Barton, LogistiCare's transportation manager, has directly told county representatives that LogistiCare is seeking to stay in Wisconsin. They are planning to respond to the next RFP. So we know that any announcement that they implied they would be leaving is misleading. Was it actually disinformation? LogistiCare is going to demand more money after it demonstrated it was not capable of holding up its end of the original contract. This company has to know that proclaiming it will leave the state and no longer broker non-emergency medical transportation in 90 days, ending service February 17th, puts the state in a difficult to impossible situation. The previous system of providing non-emergency medical transportation, arranged by county employees, has been destroyed. And some transportation providers have told Voices they are actually being put out of business because LogistiCare has not paid them for work transit they have provided but have received no monies for. LogistiCare knows they have the state of Wisconsin over the barrel. By announcing they will no longer honor their contract, the state will likely have no choice but to pay LogistiCare whatever money it demands during a potential interim period, where LogistiCare has reneged on its service responsibilities while people still need rides. This is a gotcha moment because these rides to necessary health appointments can literally be life or death situations for some of Wisconsin's most vulnerable citizens. And if the next request for proposal is structured like the first one, only LogistiCare will qualify for the business anyhow. It is highly unlikely that a responsible broker that understands the needs and challenges of this service will step forward. For that to happen, the next request for proposal will have to be completely different than the one which virtually guaranteed LogistiCare would win this business in the first place. Unless we see an open, transparent, and inclusive process, LogistiCare will likely be rewarded for its previous failure, and the next bamboozle will cost the state of Wisconsin much more money. And under a disaster recovery plan included in the original contract, LogistiCare will likely demand higher payments for the services they were originally contracted for in the first place, service levels that LogistiCare could not deliver. And remember, this privatization scheme did not save taxpayers a dime if it actually cost the taxpayers somewhere between $38 and $50 million. It actually costs the state of Wisconsin more money now. Fewer people are being provided rides, and this is negatively impacting the health of some of Wisconsin's citizens. And some transportation companies that have provided the services as brokered by LogistiCare have not been paid by LogistiCare for the services they have provided. Scott Walker is going to do a lot more privatization in the next couple of years, even though it can be shown that often this results in higher costs, reduced services, and provides little or no accountability. Paying private contractors such as LogistiCare upfront money before they actually provide any services only creates windfall profits and incentives to withhold important services. In this case, denying access to important health care appointments for some of Wisconsin's most vulnerable and high-needs citizens. This privatization, divide and conquer, can kill. But perhaps the most disturbing thing about this entire mess is that LogistiCare falsely claims it has no responsibility for their business model and operations. They misleadingly claim that the contract did not tell them how many rides would have to be provided to qualified members. LogistiCare is representing itself as a victim here, and they will use this to hijack the state of Wisconsin for some really big money if the process for the next request for proposal is not changed. Statements that there was no data to gauge the need for transportation services are misleading, perhaps even bold-faced lies. Voices has talked extensively to some inside sources whom we protect that can easily refute these claims. When analyzing the original request for proposal and then in the final writing of the contract, LogistiCare sent representatives in the field at the county level, and they did obtain information to assess the usage of non-emergency medical transportation. LogistiCare is making false statements when they claim there was no data available, yet the media reports this misinformation and these false claims. And statements by the state of Wisconsin that it had no data are also misleading. The state refused to accept this data. The state would not put in a system to collect and analyze this data. Yet many counties did have detailed and extensive records on all of their non-emergency medical transportation. The state wouldn't allow them to pass this forward. And those counties that did not have as extensive records did have some information, but because the state didn't want any data at all, there was no reason for them to provide more detailed records. The facts are this: counties collected data that served their purposes, and it was up to the state to collect data that would serve its purposes. It's absolutely absurd to imagine that a profitable arm of a large multinational corporation like Providence Service Corporation would allow a subsidiary like LogistiCare to sign any contract without any idea about the volume of services to be provided and therefore the costs of providing those services. Once one cuts through the misinformation and the disinformation, the situation becomes disturbingly clear. LogistiCare was awarded an exclusive monopoly to broker necessary medical transportation. The process of creating this contract ensured that this would be a massive failure, and those that knew county-by-county needs were systematically prevented from winning a faulty bid process. Now, LogistiCare is threatening to take their ball and go home, leaving Wisconsin with no choice but to start all over again. But this time, there is no system in place to provide non-emergency medical transportation. Even though the record shows that LogistiCare did not responsibly broker important medical transportation, they are positioning themselves to extort more money from the state of Wisconsin, socializing the costs of their service failure and privatizing an even larger revenue stream and profits. Voices will have more to report. This situation is fiscally irresponsible. It is dangerous to our most vulnerable citizens, and once again demonstrates that privatizing public services and goods removes accountability, rewards inefficiencies and incompetence, and only benefits politically connected insiders.